On this Wednesday night, inside an overloaded and understaffed intensive care unit.
It's incredible how many younger people we're seeing, people who are healthy.
Variants pushing some hospitals to the tipping point during this third wave.
I haven't seen anything like this in my entire career.
Ontario's new stay-at-home order, what's allowed and what's not. And some Alberta politicians revolt against new restrictions there. Sidelined by COVID.
We never would have thought that this would hit us like this.
What one family has endured. And collision caused. Investigators reveal why Tiger Woods crashed his SUV.
Global National with Donna Friesen.
Good evening and thanks for joining us. People across Ontario are entering a third state of emergency since the pandemic began, and as of midnight tonight must observe a strict stay-at-home order for the next 4 weeks. ICU doctors say it is long overdue, and the hesitation has led to more illness and death. More than 3,200 new COVID cases were confirmed in Ontario today. 17 more people died, and for the second day, more than 500 people are in intensive care, a record number. We'll get to the stay-at-home order in just a moment, but first we want to go beyond the numbers and the politicians to the life and death moments playing out inside an intensive care unit right now. The patients are young, many got sick at work, the doctors and nurses are exhausted. Jeff Semple has our top story tonight.
This Toronto hospital is jam-packed. That alarm ringing through the halls is code blue. A man in his 40s just arrived with a suspected case of COVID-19 and his heart stopped. Staff in the emergency room inserted a ventilator tube and saved his life, while other patients are lined up in the hallway just outside.
I haven't seen anything like this in my entire career so far, where we're this full and we're anticipating to be even more full.
Hospital staff are seeing firsthand what those dangerous, contagious COVID-19 variants can do.
It's hard. I mean, these variants of concern are definitely changed the game.
And if you walk the halls of the ICU, you can see up close the changing face of this pandemic. We were here in the first and second waves, where you largely saw elderly patients sitting in these rooms, but these days there are a lot more people who are younger.
It's hard to stomach when you see young people that are otherwise well, that you wouldn't expect to see this sick.
Most of the seriously sick in the ICU are now under the age of 60, the youngest just 21. And many here became sick at work.
We are seeing that a lot of these people are in fact essential workers.
The risk facing frontline workers is something Leo Ju's family knows all too well.
I'm really worried.
The hospital's emergency ward manager recently received news that his latest COVID-19 patient was his own aunt.
To see my personal family member going through this COVID is a completely different experience.
It was really scary. It's really high fever.
The 55-year-old nearly had to be intubated, but is now recovering. The massage therapist believes she became infected at work. Hospital staff are now calling on the province to make essential workers, regardless of age, the top priority for vaccination.
Grocery stores, the Amazon warehouse, things like that are all frontline that get exposed to COVID. So I do think it's important to realize that population is at higher risk at this point.
This ICU doctor says the biggest challenge now facing his team isn't a shortage of beds, but staff. 13 months into the pandemic, many of their colleagues have quit.
They couldn't handle it anymore. We lost a lot of nurses in the past few months, and it has brought a big toll on us that we are left to fight this.
And the result of that staff shortage? Even some available beds are now sitting empty. Jeff Semple, Global News, Toronto.
We want you to hear another voice from an intensive care unit. Dr. Michael Warner cares for patients at Michael Garron Hospital in Toronto. He's been using Twitter to post updates about what he is seeing, about the people who are dying. His post today is about how variants are killing younger people, and it's a call to action for politicians. Here it is.
I've been able to share some patient stories which I think have been helpful in connecting the numbers to real lives. But some people do want numbers to frame how they view this situation. So here are some from Critical Care Services, Ontario. In wave one, we lost a patient to COVID-19 under the age of 50 in our ICUs every 6 days. In wave 2, we lost one every 5 days. In wave 3, we're losing one every 2.8 days. At the end of wave 2, there were 44 patients with COVID-19 in our ICUs under the age of 50. As of April 4th, there were 68. I think this trend is going to continue because variant COVID is a different disease. So what do we need to do? How do we not squander this stay at home? How do we make it worthwhile? We need to go after COVID-19 where it is, and that's in those high-risk postal codes. It's in those essential workplaces. We need to vaccinate those individuals, provide real workplace safety that's enforceable, rapid tests in congregate work settings, pay people not to go to work if they're feeling unwell. Don't wait until they get COVID to give them 2 weeks off. Unless we address the root cause, these 4 weeks or however long it will be squandered, and more people will die. Thank you.
Ontario did announce today it will send mobile vaccination units to high-risk neighborhoods, congregate settings, and large employers, and that everyone 18 years and older in those places will be able to get vaccinated. It's part of a new approach from Ontario's Premier, who has been under pressure for days to act.
I can't stress this enough. Things are extremely, extremely serious right now, and I'm extremely concerned.
Eric Sorensen explains what the stay-at-home order announced today means and what it's hoped it will lead to.
Time is ticking down in Ontario, the last day for non-essential shopping before most doors are slammed shut.
Bought Mama some flowers.
Oh, that's nice.
So we try to be productive.
You can sense the dread.
Again? With a lockdown?
More than a lockdown, a province-wide stay-at-home order.
The reality is, despite everything we've done so far, the COVID-19 situation in Ontario is getting worse.
High hopes for a normal spring have been dashed by one simple dynamic. COVID variants are spreading serious illness faster than vaccines can be administered to protect us. So, the order across Ontario, stay home, except for getting groceries, prescription drugs or other essentials, or for medical appointments, or exercise with members of the same household. For businesses, grocery stores and pharmacies remain open, big box stores are limited to essential items only, and non-essential retail can have delivery and curbside pickup only till 9 p.m. And then vaccines, expanded programs for lower age groups, high-risk workplaces and certain postal codes, plus vaccines at more pharmacies and mobile clinics in areas with high COVID numbers. But most schools outside the Toronto area will remain open.
Given that this is our best chance to halt this disease, to give us time to vaccinate, why not pull out all the stops, including schools, in order to let that happen?
Evidence of the need, the surge in hospitalizations that have spiked today to almost 1,400, approaching the peaks seen in January, and numbers still rising. For some, the province has responded too slowly to the third wave.
That's probably not a bad thing and probably should have been province-wide much sooner.
And it is a body blow to the mental health of so many who've been locked down for months.
So I've just been working. I'm exhausted.
Katie Bones is a private nurse, just coping.
It's all up in the air all the time. So frustrating. Sick of it.
Allison Rains says it's hard.
It's a long game. I definitely feel the strain on my mental health.
There is a lack of awareness of how seriously mental health is affected, says one expert.
I think people are overwhelmed with the everyday life. Something around 40% of the general population is suffering from anxiety or depression.
And now begins another month of anxiety. Even children like Isla have had enough.
Let me out. We've been in this pandemic for 1 year now. Can't this be canceled?
The pandemic cannot be canceled, and a stay-at-home order cannot be postponed any longer. Eric Sorensen, Global News, Toronto.
In Alberta, a caucus rebellion appears to be brewing for Premier Jason Kenney. 15 MLAs from the United Conservative Party caucus, including the Speaker, are criticizing Kenney's decision to put in tighter public health restrictions. In a letter, the group says it moves Alberta backwards and is the wrong decision. It says constituents want them to defend their livelihoods and freedoms as Albertans. The new restrictions include shutting down indoor dining in restaurants and reducing retail capacity and stopping group fitness. Premier Kenney says the measures are designed to buy time to get more Albertans vaccinated. Many Alberta doctors say the restrictions, though, don't go far enough to reduce the stress on hospitals and intensive care units, and they are calling for an even stricter shutdown like the one imposed last spring. Well, we know younger people are getting sicker, and there is tragic news out of Quebec today. A 16-year-old in Montreal has died of complications from COVID-19. Hospital officials are releasing no other details because of privacy rules. In a statement, the hospital says people who die at a young age from COVID-19 are generally people who had significant underlying conditions. It's believed the teenager is the youngest person to have died from COVID in Quebec. The province reported 1,270 new cases today and 8 additional deaths. Global News has learned Canada's top spy, the CSIS director David Vigneault, has COVID-19 now and is working from home. Our Ottawa bureau chief, Mercedes Stephenson, has more on this. Mercedes, sources, I guess, telling Global News there have been a lot of concerns about workplace safety at CSIS.
That's right, Donna. CSIS is the spy service responsible for monitoring threats to Canada's national security. And right now, it requires all healthy employees to work from the office. But multiple intelligence sources approached Global News to raise the alarm about some of what they say they're seeing there. The sources complained about workplace safety, citing multiple COVID-19 outbreaks at the national headquarters in Ottawa and raising concerns about how physical distancing is possible at full staffing, as well as concerns about mask wearing and safety in the headquarters. In a statement, CSIS cited sensitive intelligence work as the main reason why there isn't a work-from-home option for Canada's spies, saying, given our unique mandate, our national headquarters, domestic regional offices, and foreign stations remain operational during the COVID-19 pandemic. But some of Canada's spies are questioning that rationale, pointing out that similar agencies have figured out secure work-from-home setups, including CSEC, Canada Signals Agency, the RCMP, and the military. CSIS confirmed that there have been outbreaks in the headquarters, stating CSIS has experienced COVID-19 cases, including those linked to community transmission, as well as limited and contained outbreaks. Global News has also learned that 187 CSIS employees signed a mass grievance over the agency's COVID protocols and directives, complaining that they were potentially unsafe and discriminatory against single parents who are left struggling to find childcare when schools are closed and they have to come to work. CSIS says they are committed to keeping Canada safe, as well as their employees, but there seems to be no plans ahead to change the current policies. Donna?
Okay, Mercedes Stephenson in Ottawa, thanks. It has been 6 weeks since a serious crash sent Tiger Woods to the hospital. Now, police are revealing what caused it. That's coming up. This Buddhist monk in Thailand has been rescued from a flooded cave where he was trapped for 4 days. The 46-year-old was on a pilgrimage. He went inside the cave to meditate when a rainstorm hit. A team of 17 divers managed to reach him today after a break in the rain. The monk was fitted with a mask and guided out, including a 12-meter swim underwater to get to safety. As more Canadians get vaccinated, there are continuing questions about having to wait up to 4 months to get that second dose rather than 3 to 4 weeks. Canada's National Advisory Committee on Immunization said today it stands by its recommendation. It extended the dosing interval in March because vaccine supplies were limited and they wanted to get some protection to more people faster. Now it says it has the data to back that up.
We looked at clinical trial evidence that demonstrates very good vaccine efficacy from the first dose. We also looked at new real-world evidence that suggests good vaccine effectiveness against symptomatic disease and asymptomatic infection, and very good effectiveness against hospitalization.
NACI estimates 90% of adults aged 50 and older will get their first shot by mid-June, as will 75% of people between the ages of 16 and 49. And they say as more vaccines arrive, the 4-month interval might shrink. There is more information tonight about the Oxford-AstraZeneca vaccine and those reports about rare cases of blood clots. The EU's drug regulator has released the findings of its investigation. It found a possible link between the vaccine and the rare blood clots, though said the benefits still outweigh the risks. Several countries, including Canada, recommend younger people avoid it, and now British authorities have released new guidance too. Crystal Goomansingh explains the findings.
The demand for COVID-19 vaccines hasn't changed, but rollouts are being adjusted now that a link has been confirmed between the Oxford-AstraZeneca jab and very rare blood clots.
We are not advising a stop to any vaccination for any individual in any age group. We are advising a preference for one vaccine over another vaccine.
The UK's expert advisory panel says healthy people under 30 should be offered an alternative shot if one is available. At the end of March, 79 reports of serious blood clots had been recorded in the UK, with 19 fatalities. That's after 20 million doses were administered.
From these reports, the risk of this type of rare blood clot is about 4 people in a million who receive the vaccine.
In those rare circumstances, the Oxford-AstraZeneca shot seemed to trigger an autoimmune response, leading to aggressive blood clots and, in some cases, bleeding in the brain. The risks are very low, but they exist. Health Canada adjusted the vaccine labeling back in March, noting the rare events. Doctors say for the vast majority, the shot is safe.
It's extremely important for them to take the first vaccine that's offered to them in Canada.
In Europe, adverse reactions occurred more often in women under the age of 60, but the experts who reviewed the data say they can't pinpoint the problem to any one group.
No specific risk factors could be identified based on the current data. The committee can therefore not recommend any specific measures to reduce the risk.
People are being encouraged to watch for symptoms such as chest pain, odd bruising, and swelling in the legs. The blood clotting events occurred within 2 weeks of vaccination. Crystal Goomansingh, Global News, London.
Still ahead, why a police informant is suing the force he helped. Excessive speed has been revealed as the cause of the crash that left Tiger Woods recovering from serious injuries. California police say Woods was driving about 87 miles per hour when he crashed and rolled his SUV in February. The posted speed limit on that stretch of the road is 45 miles an hour.
The primary causal factor for this traffic collision was driving at a speed unsafe for the road conditions and the inability to negotiate the curve of the roadway.
Police say Woods never applied the brakes. They believe he may have accidentally hit the gas pedal instead. Woods underwent significant surgery on his right leg and ankle and is still recovering. We're getting a rare glimpse tonight into the shadowy world of police informants. One such paid informant says he regrets ever joining a police witness protection program, and he is suing the RCMP and the federal government as a result. Ross Lord reports.
For this longtime police informant, the simple act of breathing feels like a luxury.
I'm still alive. That's always a good thing.
His birth name is Paul Derry. He's a career criminal who testified against the Hells Angels for a murder in Nova Scotia, helping send this man and 3 others to prison. Derry has had 3 name changes since entering the RCMP's witness protection program 20 years ago. He's suing the RCMP and the federal government, claiming they failed to prepare him and his family for living in witness protection.
I'd like the program to change. I don't ever want to see a family have to go through what my family's had to go through, especially children.
The lawsuit claims at no time did the RCMP advise Paul Derry or his family of potential mental health risks of being an RCMP informant. It alleges his current wife has had a mental breakdown, that his mother passed away without anyone at RCMP telling him she was even sick, and that one of his daughters thought her father was dead for 6 months as a teenager before they entered witness protection, and that RCMP did not tell her he was still alive.
She has not left her house for more than a few hours a month for 6 years. She's petrified.
Fear from the fact he's still under threat from the Hells Angels. He says his children sleep in a separate part of their house for their own safety.
They know that if anything ever happens, that the door gets kicked in or they hear noise, to go to their mother and get as far away from me as they can.
He and other family members have received psychological and addictions counseling. In a statement of defense filed with the Federal Court of Canada, the Attorney General blames Derry's problems on his own conduct and says it denies any breach of contract and further denies breaching any duty of care the RCMP may have owed to the plaintiffs. The defense statement accuses Derry of failing to acquire legitimate occupational skills and failing to cooperate with members of the RCMP. In a statement to Global News, the RCMP said it's made significant enhancements to witness protection over the last 5 years and that the program has also invested in additional staff. Police officers familiar with witness protection say the program's reputation is important because they need it to reassure people it's okay to testify against violent criminals.
Witness protection is one tool that we can use to try and alleviate that with the witness, his hesitation or fear, really.
Derry says he agrees.
The last thing I want to see happen is informants to stop working. I just want them to work under better conditions and with more knowledge as to what they're getting into.
Considering how his life has turned out, he says he might have been better off keeping his mouth shut and going to prison along with the men he implicated. At least then, he says, his sentence would soon be over. Ross Lord, Global News, Halifax.
Next, a family of 9's nightmare in Toronto after 5 of them get COVID. We want to take you beyond the statistics of this third wave tonight and tell you the story of one family. First, one of the daughters started feeling sick. Then both her parents, who were teachers, got sick too. And then 2 of her siblings. Almost the whole family caught in the grip of the virus. Karen Lieberman spoke to them about their ordeal and what they want others to know.
Well, I started feeling symptoms. One of my daughters started feeling symptoms.
Shmuley Soroka and his wife are both teachers in York Region who fell ill with COVID-19, as did 3 of their 7 children.
We have, thank God, 7 kids in different schools. We see what's going on in the various schools, and there's always risk.
One daughter was exposed in the classroom to a variant of concern and tested positive. It's believed she may have brought it into the home where it spread quickly. 39-year-old mom Alana, who was busy preparing for the Jewish holiday of Passover, became the most sick.
It just started to creep up on me that I was just sleeping more and more and more and being able to do less and less and less.
She ended up in hospital severely dehydrated with an infection and pneumonia for 5 days.
Just a lot of fear of what was going to be and leaving my family.
Including her youngest, just 5 months old.
We never would have thought that this would hit us like this. In 24 hours, it just came out of nowhere.
Pediatric infectious disease specialist Dr. Anna Banerjee has advocated to keep schools in Ontario open during the pandemic until now.
As someone who understands the need of keeping kids in school as much as possible, I think there's a balance, and I think the scale is tipped.
The Sorokas are anxious to get better and are encouraging everyone to get vaccinated.
If we vaccinate the teachers are safer, the kids are safer, families are safer.
As Alana spends most of her time bedridden, recovering from COVID-19, Shmuley has been busy caring for the family. He hopes this message gets out.
We have a concept in Judaism that Kol Yisrael Arevim Zeh Lazeh, that every person's responsible for another, and we just need to do our part, do what we can to keep each other safe.
Karen Lieberman, Global News, Toronto.
And that's Global National for this Wednesday. I'm Donna Friesen. Tonight's Your Canada is the town of Mono in South Central Ontario. There are beautiful spots all over this country. Please email us yours to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.